There's at the centre of a personal health budget is a care plan, very similar to long-term condition care planning or year of care. This plan will set out the health outcomes that the individual needs to meet, wants to meet, along with the amount of money that's available. It's not about new money, it's about using money in different ways. And then there's a planning process. Knowing the amount of money helps people to plan about how they could meet those needs. And it could be in using traditional services or traditional services provided in a different way, or doing something slightly different to meet those needs. And all of that's then set out in a plan and agreed with the NHS and signed off. We know that personal health budgets, or the anecdotal evidence from the pilot programme knows that the personal health budget works best where there is flexibility in the service, where people have long-term needs that we can plan for and set budgets for. So quite often where people have long or complex health needs, or where there's a lot of health and social care needs of an individual, personal health budgets are a way of enabling people to have a single holistic package of care. The heart of the NHS reform agenda is around getting a more patient-focused NHS and having no decision about me without me, and involving patients, giving patients more choice and control. And I think you can't get more choice and control than personal health budgets. They fit in with this wider drive to personalised services, and they'll fit. They won't be right for all services. So, for example, if you need elective surgery, you have a choice through choice of consultant, choice of hospital, rather than having a personal budget. So they do very much sit with that side of it. I think they can be compatible, and I think that they should be compatible. I think that knowing what individuals are choosing and what individuals actually want and the way they want to meet their health needs could inform clinical commissioners about the local services that are there. So, for example, if when people are given a choice, they actually say, well, I'd like to use this particular recovery pathway, then that might be something that the clinical commissioners think maybe we should be offering that as a choice for everybody. So it is about a two-way stream of information exchange. Personal health budgets are a very new way of doing things. We're more familiar in social care than we are in healthcare. And we're at the very early stages with personal health budgets. So there is a lot that we still have to learn about how to set budgets and about thinking about what services can be included, what sort of, where personal health budgets work best. And the evaluation that's going to be published in October will give us some of the information for that. But there has to be a lot of additional work done thinking about how they will fit together and how they'll work. Because we really want to see personal health budgets to be mainstream, to be part of the way things are done and part of the spectrum of personal health budgets. And actually one of the things to me as a healthcare professional, that it made me start to think about things differently. And instead of saying, right, I will come in and do A, B and C to you, it's having the conversation. One of our case studies, the only thing that they only wanted to change the order that something happened. And you thought, oh, I'd never thought about doing that in a different order before. So it's a real cultural change as well. I think one of the fantastic things that personal health budgets does is it will enable people to get the support and advice and brokerage, help if you like, to be able to work out what works best for them in their lives and help organise that. So it's not about holding the money and doing all the organising, that's an option, but as well it's through the care planning process being asked questions about what do you want to get out of your life and how can we get that. It's a very different way of thinking about things, and we could actually address some of the inequalities because people don't access NHS services at the moment, some of them because it doesn't work for them, because they can't for whatever reason, and personal health budgets may be a way of ensuring that they get the care and support that they need to prevent their condition deteriorating, to prevent some of those long-term hospital admissions because it works for them.